फिर मैं करी तो आपकी
We'll be starting in about a minute or so. We're just, as people are rolling in. Hello, everyone. Good morning for those who are joining in from the US, and good evening for those who are joining us from India. It is my pleasure to invite and welcome you all. My name is Dr. Naveen Mehrotra. I'm a board certified pediatrician in New Jersey and also the medical director for My Whole Child Center. And today we will be hopefully discussing and enlightening all of our viewers about a very common theme that's been coming up. And as you all have seen, the title of our webinar is, "Oh my God, my kid is sneezing, and could this be Corona?" It's a doubt that I think many of us have, including myself last night when I was started sneezing and my allergies kicked off. And I didn't think that I would be able to feel good this morning, but it happened. And here we are discussing the same exact topic. So some ground rules. We will be holding a Q&A session at the second half of the webinar. So you can go ahead and start sending your questions in as they come to your mind, and we will be filtering them and streamlining the responses from our expert panelists. And we hope that you will get most of your questions answered. If we're not able to answer them today live on the webinar, we will go ahead and respond to you through your email IDs and get those questions back to you. At this time, I also want to go ahead and thank the Ashiana Housing Limited for sponsoring this webinar. And me myself, being a homeowner at Ashiana, I've seen their move for these kid-centric homes focused on kids and families and trying to educate the families as much as they can, just not on the physical space, but also on taking care of their kids. And also want to thank My Whole Child Center, which provides expert pediatric services in the US, as well as our special needs care center in GK2 in Delhi, which is headed by Mrs. Hemi Gupta. So thank you all for bringing this together. And now I want to introduce our expert panel. The first panelist that we'll have is Dr. Raju Shah, a name that I am sure that if you know anything about the pediatric industry, you would have seen his name anywhere and everywhere. He's the former president and HOD of the GCS Medical College in Ahmedabad. He has been the national president of the Indian Academy of Pediatrics in 2005. He's the current president of the Pediatric Association of SARC, medical director of Ankur Institute of Child Health, with major awards to his name and multiple journal publications and textbooks in the field of pediatrics with a focus on immunizations and tropical diseases. I could go on and on, but I think we'll have to curtail it right here. But as you can see, he's quite an accomplished pediatrician in India and well-known abroad. Our next panelist is Dr. Jayesh Kanuga, who is a diplomat of the American Board of Allergy and Immunology, fellow of the American Board of Pediatrics. He's a graduate of the Cleveland Clinic, one of the leaders in medicine in the US from the Division of Allergy and Immunology. He's the director of the Division of Allergy and Immunology at JFK Medical Center and former president of the New Jersey Allergy Society, and currently involved in many different clinical trials related to allergies. So I think once again, the breadth of experience that he brings is going to be quite informational to us. And last but not least is Dr. Raj Kumar, who's a pulmonologist, MD in pulmonary medicine. He's the director of the Vallabhbhai Patel Chest Institute in Delhi, which I know right now must be overwhelmed with the pulmonary cases and COVID that they're dealing with. He's the head of pulmonary medicine and faculty of medical sciences at the University of Delhi. He's the head of National Center of Respiratory Allergy, Asthma, and Immunology. He's the chairman of WUS Health Centers, University of Delhi, and the director of the Tobacco Cessation Program. Once again, as you can see, our expert panelists here have a CV that I cannot really do justice to, but have tried to give a little bit of an introduction to them. And as we hear more from them and the questions that you will send us, they will help us to understand what's currently going on. And just to start off, I know that we have heard enough about Corona, how it has been affecting the adults, how we can curtail the spread of the virus, what are the symptoms. But really, we need to focus on the picture of our kids. What is it that, how do the kids actually play into Corona? What is their role? And why, everybody has been talking about that Corona really does not affect much in terms of kids. So we will also see some of the things that that are starting to surface with kids. So Dr. Shah, Raju Shah, can you tell us a little bit, why are kids important in this whole pandemic that's going on of Corona?
Yeah, kids are very important because it was thought that whenever there is any respiratory illness outbreaks, normally kids are first to pick up, and then they are the real spreader. They pick up, many of them may not suffer from the disease, they are asymptomatic, and when they go to their home, the elderly which are there at home can pick up the virus and become sick. And it is known that elderly become sick more, and they may be symptomatic or get a severe disease. So that is why child population is always a very important. And we have seen in the past pandemics and epidemics of flu that it is the children who carries this infection and creates problem. And that is why in this Corona, which is also a respiratory pandemic, it is very important that we look at the children. Another important thing is that the immunity of children is weaker as compared to the adults. And that is why there is always a fear that if a child gets an infection, there is a high chance that probably they will get a severe infection or probably may not be able to fight out that well. And that is another concern when we are talking of any respiratory pandemic.
Right, so it's not just that they don't have symptoms, but also about how they are the conduit. They are the cesspool of germs that is sitting there and being transmitted to people who could be getting affected to it negatively and being quite serious.
Absolutely now, right.
Yeah, so now a common presenting symptom that we all worry about is cold and cough and fever. Most of the viral illnesses that kids get, that is the presenting sign. It's the cold or cough or viral. How do you actually worry? What do you say? How when do you panic on all of this?
When child gets cold and cough, most of the time in children less than 5 years, we are mostly thinking of some viral illnesses. And yes, when we are thinking of these illnesses, it is the constellation of symptoms which are more important. But most of these virus illnesses or the other respiratory illnesses like allergic rhinitis or common cold or flu or now Corona, their symptoms are overlapping and it becomes very difficult sometimes to differentiate. But yes, there are certain constellation of symptoms which can help you to differentiate. And especially in a common cold or normally it is difficult to differentiate between allergic rhinitis and common cold. But rest two like flu and COVID will be a little easier to differentiate. But between the two, flu and COVID, it becomes again difficult. Normally in allergic rhinitis, it is mainly the nose which is affected. And so child will complain of sneezing, rhinitis, there is a stuffy or blocked nose, and sometimes there will be a mild cough. Usually in allergic rhinitis, fever is not a symptom. But when we are talking of common cold, it is little beyond the symptoms that I described, like the rhinitis, stuffy nose. Even there will be watering from eyes also. And then there will be a cough. There is some sore throat also. And there will be, uh, sometimes along with that, fatigue and body ache in a common cold because of viral illness. So we have to be careful about this, and we can differentiate between the two of them.
So if a parent has a child that has a cold and a cough and fever, should they, what should they do? I mean, right now they can't even go to the doctor's office.
Yeah, if it is just fever, cough, cold, we have to be a little thinking more. If along with that there are some more symptoms, like if there is a body ache, there is a headache, if child starts feeling having difficulty in breathing, these are the symptoms which will indicate towards the COVID illness. So if there is a fever for more than 3 days or so, there is a cold, I mean more of cough and less of cold, and other constellation symptoms which are present, probably you have to go to a facility, health facility, and try to get the test done, because then there is a chance that this could be a COVID. Normally between a flu and COVID, the differentiation can be done by a clinician looking at a child, that there will be a high fever to begin with in flu as compared to COVID, and there will be a more symptomatic illness in flu as compared to COVID to begin with. Yes, after 2 or 3 days the symptoms may be almost similar, but here in COVID there will be more of a lower respiratory problem, while in a flu it could be only upper respiratory or it could be a lower respiratory. So it is difficult to differentiate, and as such there are multiple symptoms and multiple systems involved in more in COVID as compared to the flu. So that is how differentiation can be done.
Right. So, and I know a lot of pediatric practices right now are using what's called telehealth, and the parents can get online with their pediatrician and have their child be evaluated. But there is also concerns that are they able to diagnose their child properly on the telehealth? Is that one of the modalities that is going on that people can avail of in India right now?
Yeah, that's right. Telemedicine is now accepted as a part of a treatment officially by, there are guidelines issued by ICMR as well as the Ministry of Health regarding the telemedicine. It does allow you to, examine the child through videos and through the pictures and the symptoms described by the parents and asking questions, and you can reach. But this situation where children are usually having a mild disease or asymptomatic, it becomes difficult to differentiate whether it's really a COVID or not. And in that case, if there is a fever of more than 3 days, if there is a symptoms that there is a more of sore throat, and then child developing some difficulty in breathing, or child having mild hypoxia or something, probably it indicates more of COVID than the other illnesses. So a triage needs to be done by a clinician and decide. And if there is any doubt, it is better to send that child to a health facility for a further test and reaching to the diagnosis.
So, maybe if there's not so much of a fever, then we can think that this could be allergies, and then possibly we could go ahead and send them to an allergist, right? I mean, Dr. Kanuga,
yes.
Is that something that you?
Yes, you are right. That if the child, mainly there are, there are rhinitis, stuffy nose, blocked nose, watering from eyes, like those symptoms only, and no fever. Probably yes, it is more of an allergy, and child should go to a pediatrician or an allergy specialist as per the facilities available.
Right. So thanks, Dr. Shah. Now, Dr. Kanuga, I know in the US, we utilize a lot of your services in terms of being an allergist, and whenever we suspect that allergies are the underlying problem, we'll send them to you. But I think, how would you approach a child that I would send you to? I mean, that I would send to you?
Okay. By the way, it's good evening. In India, and good morning here. Uh, our topic is very interesting. It says that my child is sneezing. Is it corona? Okay. Oh my God. My first reaction should be just calm down. Every sneeze is not allergy. Every sneeze is not corona. Okay. So we have to, calm down and think about it. Let me just give you the allergy, background of the allergy. The allergy is like a common symptoms, but allergy disorders are very, very complex. There are so many underlying diseases are connected with allergy, like allergic rhinitis, allergic conjunctivitis, asthma, eczema, drug allergy, food allergy, insect allergy. So in other words, there are so many, disorder, are connected with the allergy. So we have to keep all that in mind also. We are talking about coronavirus, pandemic. So our focus is more upper respiratory infection. In India, the allergic rhinitis is very common. Okay, 50 to 30% of the population in US suffers from allergic rhinitis. Allergy is more common in developing country than developed country than developing country. And in India, for last several years, the allergy incidence is on rise. Why? Because India is marching towards industrialization. So as that happens, the more and more people will develop allergy. So in other words, we have to keep all that in mind too. If I can just make a statement, may not be true or may not be, I should not, that in India, allergic disorder are underdiagnosed and undertreated. Most of the population is not aware of allergy. They think just upper respiratory symptoms are allergy, but it's not. There are, like I said, there are so many other disorders connected with allergy too. And what Dr. Shah described, that upper respiratory infection, upper respiratory symptoms like, sneezing, runny nose, coughing, itchy watery eyes, and all are allergy symptoms. But at the same time, they can be mimicked by many other disorders, like, viral infection, upper respiratory infection, sinus infection, non-allergic rhinitis from the pollutions and all. Even the children, the foreign body. Okay, I have seen people, kid with the foreign body, they have like constant runny nose, and parents don't even know about it. So what I'm suggesting that my allergy portion, we have to keep all this in mind. And coming back to, corona, how we do differentiate. It's very difficult to differentiate allergy symptoms from corona infection. But what Dr. Shah, said that most of the symptoms, yes, they are similar symptoms between corona and allergic rhinitis, allergy, upper respiratory allergy. As long as patient does not have fever, that may, it's unlikely that it's corona. But again, you have a lot of corona patients, they are asymptomatic to no fever, but other symptoms are also. But with that kind of thing, you have to keep in mind as a parent that whether your child has a history of allergy or not, whether parents has a history of allergy or not, because if both parents has history of allergy, that increases chances of child developing allergy almost about 70-80%. So you have to keep in mind. And in the past, if child is having a recurrent, upper respiratory type of allergy symptoms, particularly during certain season, or certain things is aggravating the patient's, or child's, symptoms like, sneezing and runny nose and congestion, then you know that your child is allergic. Particularly in USA, if the child is allergic and we think, the symptoms are from corona or allergy, we try to differentiate. It makes it easier. So in other words, history is very, very important in current situation. If child never had any kind of upper respiratory infection, upper respiratory symptoms, then, probably you may have to think that it could be corona. And as a parent, if you are panicked, don't worry, just get the testing done, because nobody can tell from the symptoms, even telemedicine, even from examination, that whether this is allergy or this is corona. And nowadays, even our office is afraid to look into somebody's nose, which can give us an idea whether it's allergic rhinitis or corona.
Right.
Thank
Thank you,
you.
Dr. But I mean, right now, as many parents would say, they can't go for allergy testing. They cannot go ahead and, have a confirmed response as to what really needs to be done, right? Dr. Shah, I think you had your hand up for a second.
You are on
You're
mute.
mute. You're on mute, Dr. Shah, I think. Yeah,
In something wrong here.
yeah.
In India, though there are cases which have been allergic rhinitis are increasing or allergic diseases are increasing, the clinicians also not able to pick them up properly. And most of these children, till they are almost 5-6 years old of age or so, are treated as respiratory infections only. And they are getting so many courses of antibiotics. So that's a common scenario, but it is increasing. But as Dr. Kanuga pointed out that in overlapping situations, it becomes difficult. But if these symptoms are mainly concentrated on the nostrils and only throat, probably there is a very less chance of the COVID or flu, but more chance of either allergic rhinitis or other type of common cold. So that is how we may able to differentiate in some of the cases, if not all.
Right. Thanks. So Dr. Rajkumar, I know you've been a champion and one of the leaders in trying to promote, the thought process behind allergic rhinitis, allergy testing. What are your thoughts on the statement that Dr. Kanuga made about, what the current state is and how are things changing in terms of allergy management?
Okay. If you see this, the prevalence of allergy in the past, it was very less, around 10% people had the rhinitis. But if you see today's scenario, the allergic diseases has increased, and the prevalence is around 20 to 30% of different kinds of the allergy, maybe anything. So the people are now aware of the allergy, and that's why basically now the allergy diagnosis have also increased. And nowadays the people are concentrating and trying to go to the allergologist and getting themselves tested. And as you know that these tests are done in vitro and in vivo test, and all over the country, I think the main hospitals or the main private players are doing these tests. And after doing the test, then they are coming out, and still the gold standard for the diagnosis of the allergy is, of course, the skin prick test. And after that, they are trying to correlate with the history, and after correlating with the history, and then they are going for the immunotherapy or avoidance. So this is the practice which is being followed in India. And a lot of centers have started now short programs also. And I agree with Dr. Shah. Basically, nowadays the pediatricians, basically in our country, in India, they have now started doing the allergy testing and everything. And at the different places, these pediatricians have taken in a very big way.
So I think that's a good sign. Because it's a different constellation of diseases and it is a different management approach. So here is a parent who has a child with a runny nose, possibly a fever, maybe a little bit of a cough. They're not sure what to do, but the steps, what I'm hearing is that they should not panic, first of all. Secondly, they should be in touch with their pediatrician, make sure that their pediatrician evaluates the child. And then if the pediatrician thinks that it's allergy related, then send them for allergy testing. Now, when the pandemic hopefully lightens up, the parent can go for skin prick testing. Now, we also talk about blood testing. Is that something that they can do in the meantime, or what would they do right now if the child has symptoms? Dr. Rajkumar or Dr. Shah or Dr. Kanuga, either one. Yeah, Dr. Shah.
Yeah, just now probably if there is not a severe disease, and so we can give pharmacotherapy which can take care of the acute attack or acute exacerbation that has occurred. So a pediatrician or a clinician can, from the symptoms and some history, past history, as very rightly pointed out by Dr. Kanuga, that helps you to make a differentiation. If there is a fever which is continuing for almost more than 101 or so, and if there is a throat symptoms also along with that, probably it could be a just common some other viral infection, and you can treat like that. But if it is not there, only sneezing and cold, probably you can treat them with a pharmacotherapy which can take care and relieve the symptoms. So such a child can be given some of the drugs which can help them, and that is how we can tide over the acute situation, and we can call them later date for making a final diagnosis whether it is an allergy or something else, and accordingly we can guide them.
Right. So I know one of the common questions that many parents have, even in my practice, I deal with this all the time, is it's believed that repeated viral illnesses are because the kid has a poor immune system, or allergies are related to the immune system. How can a parent boost their immune system? This is something that we keep on hearing from every single parent. Can you give me a tonic? Can you give me a medication? I'll open this up to everybody on the panel.
Yeah, I mean, boosting the immune system of a child. There are so many, nowadays, especially in this COVID situation, there are so many articles and many people are, coming on the media and trying to tell that do this and do that, and that can, boost the immunity. But to my mind, it is the immunity as such is inbuilt, and it's a natural process that can help. Most of the children less than 5 years are definitely having a weak immune system, and those children who are going to a day school or a preschool, they are going to come in a contact with other children, and they are likely to develop the viral infections. So immunity is mainly for preventing the viral infections. The allergies are different type of immune reaction of a body. It is the allergic reaction to the either inhaled or ingested material, and that or there are certain triggers which exacerbates the allergy. So there is a difference between the two that people should understand, that allergy is a different type, and boosting immunity is not going to help much. But there are certain things that can definitely help in boosting, and vitamin D is considered to be very important nowadays, and it helps in preventing viral respiratory infections, as well as also helps in preventing certain exacerbations of allergy also. Another important vitamin is vitamin C, which also can help in boosting or preventing viral infection. So these are few things. Then the good food, improving the nutrition of a child also helps. So these are the ways by which one can boost the immunity. In India, in little older children, one can also teach the yoga, and that can also help to boost the immunity of the respiratory system. But rest of the things, like
if there is
many suggestions of certain drinks and certain Ayurvedic products and certain allopathic products are of no use and doesn't make much difference in the immunity.
I think, Dr. Shah is absolutely right. The boosting the immune system is mainly for preventing the recurrent infection or viral infection. No matter how strong immune system you have it does not prevent you from developing allergies. So that is a totally different part of the immune system as far as allergy is concerned. So stronger immune system doesn't mean that you will not have allergies. Okay, so there is a difference. So yes, the strong immune system is mainly for preventing the infections.
Right, but the question I think the parents are having is, they see lots of different advertisements for, here, take this tonic and it'll go ahead and boost your kid's immunity, that your kid will be much healthier. So just for our listeners, for the parents that are on here, there is not one magic tonic that can be given to them. The important thing is to have good nutrition, is to make sure that they're eating a balanced meal and they're being active, and that will boost up their immune system.
That is true.
So we have a whole list of questions. I'm going to try to now open it up and go through it one by one very quickly. We have a question here from Avni that her 5-year-old has a recurrent watery eyes because of some issue. She's not sure what, and she doesn't want to go to the doctor right now. Could that be a symptom of allergies? What should she do at this point? Dr. Kanuga, Dr. Shah, Dr. Kumar, anybody?
Yeah, I think, I mean, if there is a history, the child has a recurrent, I mean, watery eyes, okay, or itchy eyes or red eyes, particularly during certain season and all, that more, I mean, is leading towards allergy rather than a COVID infection. Dr. Shah, what he described, that COVID infection, I mean, has more than one symptoms, like upper respiratory symptoms, runny nose, coughing, and all of the symptoms. But if it is just like, I mean, itchy watery eyes and during the season, it's more allergy related. In a current situation, you can't, I mean, tell parents to go and get the allergy testing done because everybody's stressed out because of the corona. So best thing is to have a symptomatic treatment done for upper respiratory symptoms, including, watery eyes or itchy eyes. You can use, eye drops, like antihistamine eye drops that will help alleviating symptoms. If the child has a sneezing or runny nose, then they can do the antihistamine. And if antihistamine, a patient is responding or child is responding to antihistamine, that means it is more related to allergy than the.
Right. So the thing is also, you know, as a physician, we might ask you to do something, but a lot of times it's much more critical for the child to be evaluated and examined in person. So just because your child has watery eyes doesn't mean that it's allergy related. It could be something else. Dr. Rajkumar, are you currently doing any sort of allergy testing right now at the hospital, at your clinic? What's the current state for patients?
We have stopped this allergy testing, and rather we have minimized or almost stopped it because allergy testing at this moment it is not advised because because the people are coming with the supposed allergy and everything, and you are advocating to the allergy testing. Maybe there are many other patients are also coming, so it is advised that the allergy testing should be avoided at this present situation, and the patient should, I agree with Dr. Shah, the patient should be treated with the pharmacotherapy, and then when the situation works out, then after that you can plan for the allergy testing and so. And we are not doing right now the allergy testing and everything.
Right. So
at present, because of the lockdown everywhere, all over country, it is not possible even to call them, because if you are doing an allergy test, they have to stay there for some time, or you have to call them 2 times at least to see them. So it is not wise. And allergies are not that, excepting in some condition, they are not an acute condition or not going to create any severe problem to a child or a person. So in that situation, it is always better to postpone such test or any type of management that needs more contacts and you have to call them more often to the clinic. They needs to be postponed. So you can manage them with the pharmacotherapy, especially with good second generation antihistaminics. You can definitely help them, and they can relieve the symptoms, and they can come afterwards when everything is normal.
Right, and I think we're getting repeated questions around this from many of our viewers. Same thing is, what can they do? How can they get allergy testing? So the bottom line is, at this present time, we would go ahead and treat them symptomatically, and then once things get better, we can go and get the detailed allergy testing done, because that will also prognosticate how we are going to move forward with our kids, right, Dr. Kanuga? I think that's something. What is the purpose of allergy testing?
The purpose of allergy testing is to diagnose whether your recurrent symptoms are from underlying allergies or not. Okay, you may have the indoor allergen which you can be allergic to, or outdoor environment like pollens, you can be allergic to. So it's very, very important when you are treating any patients with allergy or allergy related symptom, you should rule out underlying allergies. So by doing the testing, either blood test or skin test, you can get it done and figure it out what allergen is a culprit or causing these allergy symptoms. And in current situation, in parents, like you said that you are getting, so many questions about allergy testing. If parents really want to get the testing done, we cannot do, Dr. Rajkumar said, we cannot do the skin testing right now because we don't want to expose our other patients in the clinic and all that. you can order the blood test. Okay, I mean, blood test is simple to do it, and you can diagnose, I mean, underlying allergies also. Okay, so in current situation, if it is not necessary to get the testing done, but if somebody really want to get it done, get the blood test done.
Thanks. There have been lots of other questions in regards to transmission of the coronavirus in kids. We talked about how the kids are asymptomatic carriers most of the time, but do we know how it's being transmitted? What is the current situation in terms of kids in India? Dr. Rajkumar, are you seeing kids that are being admitted to the hospital with corona, and what is happening with all of that?
In our hospital, basically, is a non-COVID hospital, because in India there are many hospitals which has been made as a COVID and the non-COVID, because we want to segregate these patients so that the transmission should not occur. If I talk about Delhi, Delhi has around 5 COVID hospitals. So what is happening? All other places, what they have done. So all the suspected cases, they are referred to these COVID hospitals, and the tests are being done, and after that the treatment is being taken care, basically. So here if you see, the children at our hospitals are not coming with the COVID, but the adults are coming, and generally on an average adults are coming with the respiratory symptoms, and here it's becomes sometimes very difficult to differentiate about the non-COVID and the COVID patients, because most of the patients have the respiratory problem. Most of the patients sometimes they come with a high grade temperature, and these patients we put it as a suspected cases, and accordingly we deal it. I think for the children, Dr. Shah will be able to tell more detail about the children, because we are not seeing here children basically.
Right.
Yes,
Okay.
Naveen, I can answer it a little more clearly. The COVID infection it's a respiratory infection, and it is a droplet infection. Droplet means when we are talking, when we are singing, when we are shouting, when we are coughing, or when we are sneezing, we bring out many droplets, which droplet size may be smaller or bigger, and they carry these virus particles with them. Now, there are experiments which have shown that during talking, most of the droplets travel up to almost 2 to 3 feet. But when you little cough or sneeze, these droplets can travel up to 6 feet. And that is why this social distancing, which has been suggested, is to keep the distance between 2 people of 6 feet, which, the normal, the droplet travel area is there. And so if you are not that near, probably there is a less chance of getting the infection. Unfortunately, with this COVID, as against the SARS-2 and influenza, it is the asymptomatic people, or those who are carrying this virus, they are spreaders. People themselves don't know that they are suffering because they are asymptomatic. They are not tested, and they carry these viruses with them. And when they speak, when they shout, when they cough, when they sneeze, they bring out these viruses, and that gets, the other person infected. And fortunately for children, the infection all over world, even in China, America, or everywhere, the percentage is much less as compared to the adults. Everywhere the experience is that it is probably less than 2 or 3% of all the COVID diagnosed patients. The children population is almost less than 2% or so. Similarly, over here also, though in Gujarat we have more than 150 cases or so by now, and we have at least 10 or 15 mortality, but the majority, almost up to say tune of 85% of the children are asymptomatic, only 15%, and out of that again 10% are having the moderate disease, and only 5% are having a severe disease. Children less than 1 year are the very high risk group, and if they suffer, they may be more severe, and there are also they need a intensive care treatment also. So this is what the situation at present. So though the viruses are shed from the nostrils, from the cough, from the even eyes, in GI tract, but still major infection is through the droplets. It can spread through eyes also, but major infection spread is through droplets. There are some experiments which have shown that it could be a little aerosol or airborne infection also, but it has been not proven. But because of all this not very clarity, nowadays there is a also recommendation that all the persons going out should put on the mask, so as these aerosol type or airborne infection also can be prevented. So these are the few ways by which you can prevent, and this is how the virus spreads to the other person. It can also spread through fomites. So
Right.
whenever the person speaks or coughs or sneezes, the viruses or droplets remain there for almost 1.5 hours, and after that they fall, and they fall on different types of surfaces. So different type of surfaces can keep those viruses, and if you touch that virus and then again touch your body, you can get. And that is why there is another recommendation is to wash your hands more frequently, so as you don't carry those viruses from those fomites. And the surfaces which can keep for a longer, they are like steel surfaces, there are certain wooden surfaces, even the cardboard and all those can also keep it for almost 24 hours or so.
Right. So along those lines, there are several questions here, Dr. Shah. Is does the virus stay on the skin? When a parent goes out and works and then comes back and they hug their child, is the virus being transmitted? How long does it stay on the skin? Does it get into the hair? Is it just in the hand washing? If there are pets around, animals, are they carried on the pets? If there are plants in the house, are they on the plants? So there are multiple questions. I'm clumping them into one from many different of our viewers. So I don't know if you can touch on all of that very quickly, because we have a lot of other questions to go through.
Yeah, right. Yeah, it can definitely stay on the skin, and that is why the commonest skin that is in the hands. That is why we are always telling to wash the hands. So inadvertently we can touch different surfaces when we are moving out or we are working, and by doing that you are carrying your viruses on your body. And there are studies which have shown that most of these viruses are more on your hands rather than any other part, or it can be on the face also, but more on the hands because you touch different surfaces. The other part of body gets virus if you have come in a direct contact or in a close contact of a person who is asymptomatic carrier and he has cough or sneeze, then there is a chance that it could be there on your clothes or other part of body. There are reports which have shown that majority of infections are because of from fomites that hands have carried, and that you touch your face with the hand. That is why it goes into the head, face, and then nostrils, mouth, and eyes. So it can enter from nostrils, from mouth, and from eyes also. So that is why they say that don't touch your face so often. When you are, there is a cough etiquette that has been shown that is why you don't, produce the airdrops which travel longer. So that is how it is there. So it's mainly hands which can carry. It can your clothes also. If you are in a COVID atmosphere, suppose that healthcare worker is there, and if he's going there and coming back, there is chance that his or her clothes are also having the virus particles. And so it is, they need to don the PPE, then adopt the PPE at the site where they are working, so they don't carry. Another important is if you are, working in the area where there is a high chance of even asymptomatic patients, or you are gathered at one place, like then when you come home, it is better not to hug your children, remove your clothes, take a bath, and then, play with the children or hug the children. So that is how you can prevent. But major issue or major problem is your hands rather than any other part of your body. Similarly, pets, there are now some reports that cats can, human can transmit the virus to cats and cats can give. So there are reports, but not 100% confirmation. So that's important. And again, if the pets are going out and they have hairs, probably virus particle can remain there for few hours, but not a longer period. So that is how pets also can live. there is always issue that if you are getting a post or a parcels which have come and whether it can infect or not. But the report says that it can stay there for a say period of 10 to 12 hours on the paper or cardboard or the packets. But normally the particles are much less, and that is why chances of getting infection from those type of fomites is not very high. And so people say that you can definitely use them. Similar cases with the newspapers. People are afraid of taking a newspaper, using newspapers, but there are reports that newspapers doesn't spread infection that much. So more, if you take care like that, if you put on the mask, if you are keeping a distance of 6 feet, if you are washing your hands frequently, I think chances of getting infection will be much less for a normal common people in the community. For healthcare workers, things are totally different. Those who are working as a front line, like policemen, those who are working in certain such areas, they have to be more cautious and take certain type of precautions so as they don't carry the infection with them.
Right. So thanks. I think these are common questions for a lot of our viewers, because they're all worried about, the transmission of the virus itself, where it stays, what should they do as they're starting to go out and come back in from, work or shopping? How do they handle their kids on this? How can they keep on boosting their immunity? How can they go ahead and take care of making sure that their child stays well? One of the other common questions that is coming up, and I think we can touch on it, is immunizations that kids should be getting, but now because of the whole fear around corona, most of the parents are not going out to get the vaccines. Would you like to touch on that, and how does that impact the immunity, if there is any relationship to that?
Yeah, this is very, very important issue, and we are, as a pediatrician, much concerned about this, and we have read the reports because India has a big cohort, and almost every week there are 5.5 lakh children are getting born and getting added. Now, when we stop all the immunization, as we have stopped doing tests. Similarly, we have stopped doing giving immunization also in most of the areas, and that is why this backlog is increasing. And last 2 or 3 months, we have now more than 15 to 20 lakhs children which are not vaccinated. Similar cases in the private practice also, because most of the areas are locked down, the clinics are almost closed, or they are only treating the emergency patients, and so immunization services are almost at a standstill, and that's going to create problem. My advice, yesterday only I gave one talk on webinar, and I advised to my clinician friends, pediatrician, that we should start, or we must continue our immunization services, especially for the infants, especially the primary vaccines, the first 6 months, because these are the killing diseases. And if you have a big cohort of children which are not vaccinated, there is likelihood of outbreaks of such diseases. So we must give, and the first vaccine that normally we give within 24 hours. So at the area where child is born, newborn, at that place only child can be vaccinated. So as when the child goes home, they have their primary vaccine, that is BCG, hepatitis B, and OPV that has been given. And then first 3 vaccines that we normally give within 6 months must be given at a proper time in such a way that you don't infect those children. And what I advise the clinicians, that you should have a special slots of your OPD for vaccination only. Call those at a interval of certain 15-20 minutes, so as they are not clubbed together all children at a time, and vaccinate them so as they are protected also, and they are protected for infection. I advise the parents to come only one attendant. The seniors or elderly in the family should not come accompany with the child, so as they should be protected. And that is how this vaccination process can be done. The other vaccines which we give after 6 months can be also given on a priority base depending upon the situation. In this pandemic and respiratory disease epidemics, we would like to get all children vaccinated for pneumococcal vaccine, for influenza vaccine, and for a measles vaccine. These vaccines should be prioritized and should be given so as they don't suffer. There are, we have seen last year only outbreaks of measles in European countries as well as USA, because there was a big cohort of unvaccinated children and they got this disease. So similar situation can arise in many other countries if this cohort becomes very big. And so it is very important that give vaccine. I would like to just remind that the RO of the measles is almost 11 as against what we get of COVID is, only 1.6 to around 3. So this is such a high RO of the measles disease. And so if we are not given that vaccine, probably there is a very, very high chance of developing outbreaks all over. So that is how vaccination needs to be done. In this situation also, we must start vaccination and we should give, and children should receive the vaccines depending upon the age of a child. Yes,
Right.
the post-infancy vaccines can be postponed and boosters can be postponed till there is a normal situation, so as they don't have to come to clinic or getting infected.
Right. So thanks. So bottom line is make sure you vaccinate your children as much as as you can stay on schedule. We have a question from Dr. Wasan. What is the role of mometasone nasal spray in allergies? Are you using normal saline drops versus nasal wash? Dr. Kanuga, would you like to take that?
Okay, so nasal spray for membrazone, it's any a steroid, nasal spray works as an anti-inflammatory. So, and most of the nasal sprays are approved for 4 and up or 6 and up, depending on what country you are in. So that's anti-inflammatory and that does help. But my suggestion in the pediatric age group is that try to use antihistamine, which controls symptoms. If it does not, and patient has more symptoms than milder symptoms, then you can use any form of nasal steroid spray, basically.
Okay, thanks.
Nasal saline irrigation is one more question is there, but nasal saline irrigation doesn't come as a first line treatment. It is
it does not.
Maybe an adjunct treatment, and sometimes it helps, but it's not really helping. Nasal saline irrigation will wash out the allergens which are there, but it doesn't prevent the effect that has already occurred in a child or a person. So as very rightly pointed out, we start with the therapy as antihistaminic, try to look at the response. If there is no response and if the symptoms are continued or it is a moderate disease, then only we think add or change to intranasal steroid, and that is how we manage. And this could be a nasal saline irrigation can be an adjunct to the intranasal steroids.
Right.
And in our practice, we use a nasal lavage or nasal or sinus lavage for the patient who has chronic rhinitis or chronic sinus infection. And most of them is mainly adult, not the pediatric age group.
Right. So we should go ahead and use the saline nose drop as an adjunct to make sure we clean out our nose. And that actually goes along with our Ayurvedic principles, and there are questions around that as well. And in terms of yoga, is that helping our children for allergies related symptoms? We have a very interesting question from Dharmiji here. Patients with known allergy related symptoms, can they also get COVID infection? And how would we test them? Would they get missed? What happens if it becomes very severe? I don't know if this might be more of an adult related response. Dr. Rajkumar, would you want to comment on that?
No, these patients can get the COVID-related disease, but it has been found that the CDC has stated that the patients with the moderate to severe asthma could develop the severe disease, but there is no data which authenticates this. Still the data is raw, and one of the reports which has come that in case of the asthma, there is increased chances of exacerbation, and that also only one report has come, and that also between the 18 to 50 years of the age. But there is no data as such which shows that the asthma, there is an increased chances of getting the COVID infection, and so except for whatever I have told, these data are there. But yes, if these patients can develop some maybe some infective pathology, then there are chances that these patients can develop these COVID infections and so on. And we are also seeing some of the patients when they have the comorbidity of moderate to severe asthma, they somehow the other come with the history of temperature, and if there is a patches which are there in case of the X-ray and everything. So these patients are investigated for the COVID, and some of the patients has come COVID positive. So that's what limited data which I can share with you.
Right. So thanks. I know we're getting towards the very
these
end.
are also in the adults basically.
Right. I know there are still about more than 25 questions left to answer, and I know we only have about 3 or 4 minutes left. I'm going to try to get to some of the critical ones, and whatever else we are not able to go ahead and get into, we will send you responses later. This is something that I think is going to be a concern for a lot of our parents, and the fear is escalating because there are, and this question has been asked by Mr. Vipin, that any comments about Kawasaki disease type illness that is being surfaced in kids with COVID-19, that we're starting to see the multi-system epidemic, the inflammatory epidemic, Dr. Shah?
Yeah, there are now, before 1 month, there were some reports from UK that almost 10 to 12 children developed this systemic hyperinflammatory syndrome, which is almost like a Kawasaki disease. And also there were some reports of another disease like toxic shock syndrome. And now in last 10-15 days, we have reports from USA that more than 102 children in last 2 weeks or so have been identified as this type of systematic hyperinflammation syndrome, which is almost like Kawasaki disease. Majority of these children are either had history of, they were COVID RT-PCR positive, or they are having antibodies which are telling us that child has suffered from COVID. Now, till now, there are difficult to establish the correlation between the two. People are studying, but those reports are there that children suffered from COVID are after about almost 6 to 8 weeks have started showing this type of Kawasaki type of disease. Fortunately, till now, there are no such reports from India, but most of these reports are from European countries and from America, and people are really concerned that till now we thought that it is an acute disease only, and that is why we were worried about those acute symptoms and only respiratory or lung problem. But now we have realized that it can lead to later problem of hyperinflammation, and if this continues, probably it can be a very bad situation for children, and all these children are less than 15 years of age. So it is mainly limited to the pediatric age group and not occurring till now. There are no reports from the adult age group. These patients need a special treatment because there is going to be a hyperinflammation all over all the systems, and mainly it is the heart and the coronary artery which is involved, and that creates a problem. And because of that, there are also almost mortality of certain number of children also.
Right. So the current state of the numbers right now is about, I think last one I checked yesterday was 345 cases worldwide that have been reported by WHO, that these kids might have had asymptomatic COVID-19, and now a few weeks later are showing up with these symptoms of what is looking like shock. They may end up in the ICU. We've had a few deaths around it as well. So the bottom line from the takeaway message on that is, if a child has fever of more than 3 days, if the child develops any sort of a rash, you need to be in contact with your pediatrician. The pediatrician should evaluate your child, on telemedicine, and see if that child then needs to go to the hospital and be managed there. So this is something that all parents need to be aware of. And I know we're towards the end of the time. There's one question that I think a lot of parents will also have that I wanted to take, and that came from Mr. Tushar Shah, is how do I talk to my kids about COVID-19? And how do I relay the anxiety and the fear that is there in our kids? Yeah,
most important is the counseling has to be very clear. we don't want our children to get panic because of this. So we need to explain, especially two things, that this is a disease which can infect the people, but it doesn't kill. And especially in children, they are more of asymptomatic or mild disease. It doesn't kill, so don't worry about that. And mainly the infection you get if you come in a contact with a person who is suffering. So the social distancing we need to teach them. We have to educate them about the importance of washing hands repeatedly, not touching the unnecessary things, and putting on the mask, and importance of putting on mask, all these. Another important thing that you can also teach, that when a parents come back from their work or from other area, don't directly hug them. Let them change their clothes or clean themselves and then play with them. So educating that disease per se is not that bad and not going to kill you. But we need to prevent that, and prevention is more important by doing these steps. So that can definitely make them happy.
So thank you, everybody, and I will just take 30 seconds of parting words from everyone for our viewers for listening to this webinar. Thanking Ashiana, thanking My Whole Child for bringing this together, and all of the questions that we have had that we're not able to answer. I think I still see more than 25, 30 questions on the panel on the thing. We will send responses back to you guys. Dr. Shah, any closing remarks, please?
No, but most important part is that children can suffer from the disease, but as again I had told that fortunately the COVID disease in children is less, and it is less serious. They might have asymptomatic disease, but prevention is definitely very helpful. We need to boost their morale also, and try to explain and educate them, so as when again when lockup opens up and when they go out, they should prevent the disease, because this disease is not going to go that fast. It is going to linger in the community for a long period. So they must be educated properly, so as in future also they don't get disease and they don't bring the viruses at home, because the elderly people in the home get viruses only from the people who are going out, and they are likely to suffer more. And so till we get vaccine, we need to continue taking all these precautions, which is very important.
Thank you, Dr. Shah. Dr. Kanuga, any parting words on allergies and what the parents and so on?
Yeah. So what our topic suggests, the sneezing. Oh my God, my child has a sneezing. Is it COVID? My suggestion is that every sneeze is not allergy. Every sneeze is not COVID. So calm down. Allergic diseases are more common in pediatric age group, particularly from 5 to 15. So if they have, all these allergy type symptoms without fever, try to give them symptomatic treatment like antihistamine and other treatment, and see whether child is improving. If not, then, and if you are stressed out, just go get the testing done. So that way you can rule out whether the child has a COVID or not. Thank you.
Thanks, Dr. Kanuga. Dr. Rajkumar?
Yeah, the message is basically there's nothing to panic. You should not panic, and the preventive aspect has to be taken care. The mask, hand washing, and the distance. So these are the three components of the prevention that has to be taken care for the general public. That's all. Thank you.
Thank you, everybody, for listening in, and we hope you were able to get some information that will be valuable to you as you go through the pandemic, and we'll try to come back with other topics down the line. Thank you, Ashiana. Thank you, My Whole Child Center.
Thank you.
Panelists. Thank you so much, Dr. Shah, Dr. Rajkumar, and Dr. Kanuga.
Okay, thank you. Have a nice day. Bye.
Thank you.